understand for me, okay, you're watching the stream. In the UK, if you're black or brown, you're more likely to die from COVID-19. We have an impressive lineup of guests who are trying to work out why. If you have a take and you're on YouTube, jump into the chat. We would love to hear from you. And that's one way that you too can be in the stream. Hi, I am going to introduce you to the guests, and the guests will introduce themselves to you. So let's start with Dr. Frank. Dr. Frank, tell everybody who you are.
Yes, hello, good afternoon, everyone. My name is Professor Frank Chinagwundo. I'm a consultant urological surgeon based in London. I work at Barts Health NHS Trust. I'm also the chairman of a registered charity called Cancer Black Care, and also a trustee of the prostate cancer charity Tackle, which is a federation of support groups.
So good to have you. It's good to have you in the stream. Thank you so much for joining us. Patrick, tell everybody who you are.
Hi everyone, America. I'm Patrick Vernon. My background, I've worked in health and social care as a commissioning services, running services, and then I've been involved in politics. I'm a culture activist, culture historian, and I've been very actively involved in the community response around COVID-19 in the UK.
You're very welcome to the stream, Patrick. And we're not just going out in America, we're going out around the entire world. Thank you for joining our global conversation. No pressure. Hello, Dr. Schichter. We cannot have this conversation without you. You have the research, you have the stats, you have the data. Tell everybody who you are.
Thank you so much. So good afternoon, everyone. My name is Dr. Schichter Das. I'm a genetic epidemiologist, and I research on the genetic differences in ethnic groups in the cardiovascular diseases. I specialize looking at diabetes at molecular level in ethnic groups, and my interest is to find out why these differences exist, if they do. And I'm very glad to be here to be talking about this topic.
So good to have you, guests and audience. I want to show you something here on my laptop. You know, we always ask you, what story should we be doing? And this just came through from Asad Beg, and it wasn't very long ago. And Asad is one of our reporters. He often reports on Iran. He also grew up in the UK, and he wanted to talk about the disproportionate number of BAME people affected by corona in the UK. BAME is something that you're going to hear a lot in this conversation, that acronym. Black, Asian, minority, ethnic. That's how people in the UK talk about people of colour from ethnic backgrounds. So that is what we're talking about. Dr. Frank, thank you so much for being on this show, because one of the reasons you're here is because you are part of this unusual set of statistics. You have faced COVID-19 in your family. Can you tell us what happened?
Yes, you know, I've had two experiences really to relate. The first was that we lost our father to COVID-19 on the 3rd of April this year. My father was 92, but in reasonably good health, although he didn't get out much. So he became unwell, and we had to take him to hospital, where they diagnosed coronavirus. His chest X-ray and CT scan showed that, you know, the typical signs of COVID pneumonia. And sad to relate, from having been well within 1 week, despite the sterling efforts of the hospital staff, he passed away. That was a big shock to the family, as you can imagine, because, you know, it wasn't as if he'd been unwell before this. And then, you know, that's compounded by the various social and cultural things that we weren't able to do, such as friends and family gathering round to support us. The funeral that we had 3 weeks later was only able to be attended by 10 people, although we were able to Zoom the funeral across the world, where he had many family and friends. And then also alongside that, quite separately to my father, I became unwell myself, and tested positive for COVID. So I had to take some time off work. I mean, I was really fortunate in that I only had a mild disease, and so I wasn't particularly unwell. But nonetheless, within my household, with wife and children, I had to kind of self-isolate from them, and for 7 to 10 days had no contact with them. So, I've got personal experiences of this COVID-19. And of course, on a professional level, because I'm a surgeon working in the National Health Service as a urologist in London, our activity has necessarily had to be severely curtailed. So we've not operated really for the last couple of months because essentially the hospital has been turned over to dealing with the COVID-19 patients. Furthermore, we've not had any face-to-face consultations except in dire circumstances. So all my clinics have been done by telephone consultations, which is fine as far as it goes, but you do lose a certain interaction with your patients. So it's been a tough couple of months.
I'm so sorry for your loss and condolences to you, Dr. Frank. The first time I noticed that maybe there might be something very strange going on was the number of doctors in the National Health Service who appeared, and medical professionals who appeared to be dying in quite large numbers. For instance, let me show you this. This is Mahathir Pasha, who back in April was listing doctors who were dying. Look at that hashtag, NHS Heroes. Patrick, when did you notice that something was a little bit odd?
I think it was really when we had just for the lockdown in the UK, that was around about mid-March. There were obviously people. We had early indications of people dying of COVID-19. They were in the low hundreds and thousands, but I noticed right towards late March that there seemed to be an increasing number of people from Black and multi-ethnic communities and frontline staff, doctors, nurses, other ancillary staff, and then later on staff working in transport and retail. And at the time, the government announced to open these emergency field hospitals, and they called them after the nurse Florence Nightingale. And I launched a campaign to say, hold on, we're losing all our Black and Asian staff in these hospitals, in care, and yet there's no recognition of their loss. There's no recognition of their contribution to the health service. And why can't you acknowledge someone like Mary Seacole, who was also at the Crimean War at the same time with Florence Nightingale, and she should be recognised and reflects on the diversity of the NHS. And that led to a whole debate around that, and also the whole campaign, and also for the last few months, every Thursday evening at 8 o'clock, there'll be the clap. But the clap didn't really reflect the diversity of NHS staff at the time. And there was a fantastic little video that was made saying, "You clap for me now, and we're dying." And that kind of epitomised the frustration. A lot of NHS staff who felt that still were not being validly recognised and were dying like flies. I make the comparison with the First World War. In the First World War, if you were an African soldier in Africa, or a Caribbean soldier based in Europe, you weren't given any live ammunition or gun, and that was how frontline staff were treated by the government, not having necessary PPE and left to die and not having the proper necessary support.
I want to bring in Shaista Aziz here. Shaista is talking about the impact on the British Pakistani Muslim community. Okay, I'm hoping to bring her in a little bit later. But these thoughts that people were having and the deaths that we were actually talking about, Dr. Shikta, do we have data to explain what is going on here? Because I'm looking here at a Guardian op-ed from Sadiq Khan, and Sadiq Khan was saying that more BAME people are dying from coronavirus, and we have to know why. This is your work. Why? Can you help us out as an epidemiologist? And I know this is research that you're actually doing. Go ahead. All right. Unfortunately, I feel that I've lost contact with our epidemiologist. If you hear me start talking and stop me from talking, that would be fantastic. We are live right now. This is our YouTube discussion about Black, Asian, Middle East, and people of ethnic descent who appear to be dying from greater numbers of COVID-19. Dr. Schichter, are you available? Can you hear me? And I can't, no, that's not happening. All right, so let me go back to our conversation here and see if I can bring in Joan. Joan is from the director and the Florence Nightingale Foundation, and she was talking about one idea about why BAME communities are suffering more from COVID-19. Let's take a look.
The reason why Black, Asian, and minority ethnic health and social care workers are more likely to be affected by COVID-19 virus is that the majority of them are working on the front line in lower positions in healthcare settings. Secondly, many of them do not have the appropriate personal protective equipment. Thirdly, managers are redeploying them to COVID positive areas. Fourthly, many of them do not have the confidence to say they do not feel safe working in COVID positive areas.
Dr. Frank, people are on YouTube watching us right now, and Manisha Daniel says, I thought COVID affects all without discrimination.
I wish that was the case, but it isn't the case. You know, there's very good data to show that being BAME increases your risk of dying from this virus. Depending on which study you look at, and depending on the time scale of that study, because data is evolving all the time. But I go by the Office of National Statistics, who in their report of May 2020 said that if you accounted for age, Black men were 4 times more likely to die from COVID-19 than their white counterparts. And if you looked at Bangladeshi and Pakistani and Indian men, they were, 2.x chances of increased chances of dying from COVID-19. And then they went on to further try and allow for confounding factors like socioeconomic status, employment, where they lived. And then they said if you take into all the confounding factors that they had data on, and that data is from 2000 census, if you allowed for those confounding factors, Black men still came out as twice as likely to die from COVID-19 as their white counterparts. And Asian communities, it was 1.3 to 1.8. So in my mind, there is no doubt that being BAME puts at increased risk of succumbing to this virus. The question is, why? Is it to do with the frontline occupations that BAME community find themselves occupying? Is it to do with the comorbidities such as diabetes, hypertension, cardiovascular disease, obesity? So yeah, sure. So we're not sure of the answer as yet.
We don't know is not very comforting, Dr. Das, if you're a person who's Black or brown living in the UK and COVID-19 is very much an issue there right now. What do you know from the research? What can you tell from the stats?
So Femi, thank you so much for inviting me. I think it's very, very important what we are seeing here, what data is showing and what the previous research to COVID has shown. I think I would really like to start with one very important factor, which is the definition of ethnicity. Ethnicity is a genetic construct, a social construct, a behavioral construct. What ethnicity is not a biological construct. By what I mean is we cannot really define ethnicity based on the skin color or hair type. And that is an important feature we should remember. What I would really like to say is that, if you look at this particular problem in two aspects, the first aspect being that looking at the classical risk factor, as Dr. Frank was just mentioning, obesity, diabetes, hypertension, chronic lung disease seem to be most susceptible, making you susceptible towards coronavirus and higher mortality. What I really mean is that if you have diabetes as well as you get coronavirus, there is a higher chance of you dying. But if you have diabetes, there is no higher chance of you getting coronavirus. So one has to know this difference, especially. And if you look at the research which we have done previous to coronavirus, what we really see is that the BAME group is at a disadvantageous position with these pre-existing conditions. When we combine there might be some genetic link, and we would like to find out, but at the moment we really don't have a conclusive evidence towards the genetics. And the second part of my answer would be to look at the environmental and the lifestyle factor, which we do know has a major impact in looking at these cardiovascular diseases in the BAME group. And if you focus on the environmental and the lifestyle factors, what we do know is that the social deprivation, the socioeconomic status has been a very good indicator of showing these disproportionate associations with the cardiovascular diseases.
So Patrick, as a black man living in the UK now, you have a one-on-one you could have with an epidemiologist. What is the most critical question you would like to ask Dr. Das?
Well, I mean, science is great and it has its uses, but science does not answer all the questions. I mean, I've had the privilege of working in the NHS and worked with public health specialists and academics over the years, and I'm working with some now. But actually, you need to look at the wider issues affecting the disproportionality, and we have to acknowledge the history of empire, the history of colonization, and the impact of everyday race and discrimination, which has an impact on your physiology and your mental well-being. So if you are constantly denigrated, discriminated at school, in the workplace, in the public highway, it has an impact on your physiology and your mental well-being. And I think
So
this
Patrick,
is an important factor.
that's you're sharing that knowledge, but did you want to ask Dr. Das a question, or do you feel that you already know the context within which people who have an ethnic minority background, that they're already struggling because of those stresses that you're discussing?
Yes, that's my question to Dr. Das. She's always explained that race is a social construct, and we know why it was constructed in the first place. So that's my question.
Dr. Das?
Yes, I'm really sorry, Patrick. I kind of missed the last part. I couldn't really hear your question clearly. Would you mind just quickly asking me again?
Patrick, make it a sentence and ask it again.
My sentence is, do you think that the history of colonization, empire, and structural racism in society has an impact on people's lifestyle and their morbidity to certain health conditions?
I would like to quote something, Patrick, which is very, very relevant here, is by Angela Saini, who has published books on superior and inferior. And she has mentioned that it is racism that kills, not race, which is so relevant. And as you mentioned, there could be an element of the structural racism, which we see here. Unfortunately, I am a genetic epidemiologist. I look data from the genetic and more from the epidemiological point of view. So I'm not an expert to comment on this, but what we do see is social deprivation having a big role here. We do see data coming through from ONS and NHS England, which shows that, if you were in the least deprived area, you seem to be more in critical care, and 30% who were in the critical care seem to have died. So there seem to be some correlation here. What is very important to know is that this correlation between the socioeconomic status and health outcome has been laid bare by COVID, and which is very significant. We need to work on this. We cannot see more BAME dying in the second round, in the second wave, or even in future. So we need to work on this.
So let me just add, ONS is the Office of National Statistics in the United Kingdom. JJ is on YouTube. JJ, thank you for asking this question. I have exactly the same question. Are you aware, guess, if there is a connection between severe outcomes for COVID-19 with vitamin D deficiency if you're black or brown? Dr. Frank, I have to say that my sister who lives in the UK, and I've got lots of relatives who work in the health system, they all are sending around a WhatsApp video, which is about take vitamin D. It's going to help you if you're dark skinned, if you come from somewhere where typically you're in your heritage, you would have come from of Africa or the Middle East. Take vitamin D. That's going to help you. Is there something that might be biological in our ethnic backgrounds that could make us more susceptible to COVID-19? What do you know?
Well, I think taking vitamin D is a good idea. We've known for many years that, I'll take East London as an example. Something like 75% of those in East London in the UK have vitamin D insufficiency, and a smaller percentage are actually very badly depleted in vitamin D. And we know that vitamin D has a role to play in protecting you against various respiratory diseases. And there was a study, a small study, and just one study from the Philippines that did seem to link your vitamin D status with how well or how badly you did from COVID-19. We also know that if your skin is dark, it takes a lot more sunlight to make the same amount of vitamin D as if you have whiter skin. And so I think taking vitamin D supplementation, and indeed the government have said that all of us should be taking vitamin D supplementation. But I think, in my opinion, I accept that the data is not there as yet. But
So
my
we don't know. So the fact is that when my sister sent me the WhatsApp and I went out to buy some vitamin D, I'm not doing myself any harm, but we don't know if there's a direct connection quite yet. Let me show you, audience, something that is happening now in the UK. Have a look here on my laptop. This is a British Medical Association. What we're looking at here is an official government review into what is happening with people of colour, black and brown people dying more from COVID-19. That is ongoing. We should get the results very soon, at least the early results. Labour, the opposition party, is doing their own investigation. And I just want to introduce you to a surgeon here. This is Gert Randhawa, and he thinks this report is due to be published very soon. We spoke to him earlier to see what difference he thought that may make. Let's have a listen.
History tells us that the impact of pandemics tend to mirror structural inequalities in any given society. And we know that in the United Kingdom, black and minority ethnic communities are disproportionately more likely to be impacted in terms of having greater risk of underlying conditions, be that diabetes, cardiovascular problems, obesity. We also know they have poorer employment outcomes, are more likely to be on zero-hour contracts, and therefore their exposure to COVID-19 risk is much higher. We need simple action from government, and that is to have equality impact assessments conducted for all COVID-19 action plans so that we ensure true equity for all of the UK's population.
Wow, he looks so tired, but thank you. Those good points that you were making there. Let me go to YouTube. Samzi Zahid says, my question is, why was the government too slow to act, knowing that the BAME community is the most affected? Dr. Frank, you've had your own losses. You had COVID-19. What do you think about did the government act in time, too slow? Just briefly, we're at the end of the show now.
Yes. I think overall, not with specific reference to the BAME community, but overall and with hindsight, perhaps certain measures could have been brought into place a bit earlier than they were. I think specifically with the BAME community, it took a while for us to admit that there was an excess mortality amongst that
Mm.
population group. But once that was kind of appreciated, and once that was
Right.
realized, then certain things, measures were put into place. So, for example, risk assessments,
Dr. Das, this
where,
has
where
got quite. I hear you, Dr. Frank. Dr. Das, this has got quite political. Labour has a review. The government has a review. What is the most important thing that we should be thinking about right now, in a sentence?
I think the most important thing at the moment is to really do, as Dr. Frank said, about the risk assessment, about PPE. We need to provide all these interventions in terms of language accessibility to these community. We have to reach community level, which the government did not manage to do in this first wave of pandemic. And that is very, very important, Pam.
Thank you so much. Thank you, guests. We really appreciate you. Thank you, YouTubers. You've been doing an amazing job of just asking your questions to people who are trying to find out the answers. I'm not sure we've given you an answer as to why people who are Black, Asian, from minority ethnic backgrounds, why they are getting COVID-19 more than anybody else in the UK. But certainly you hear that the research is happening. Thanks for watching, everybody. Thank you, guests. I will see you next time. Take care.